debate. Order, order. Jackie Doyle-Price to move the motion.
Thank you, Mr Brady, and it's very good to have you in the chair for this important debate. And it's a very real honour for me to chair the all-party group on pharmacy, not least because so many colleagues are big fans of the pharmacy sector. So I'm very pleased to be moving this debate here this afternoon. I'm pleased to see so much support from members to recognise the huge contribution that our community pharmacists have made during this COVID pandemic. They are the front door to our NHS, and their doors have never been closed throughout the last year, and we are all very grateful to them. But that contribution has not been without consequences for the sector, for pharmacists, both financially and in terms of their own personal well-being. So this debate is really a chance for me to make a plea that the government and the NHS fully appreciate the contribution made by our community pharmacists and ensure that they are recompensed adequately for it. Pharmacists can play a much fuller contribution to primary care, as they have shown in the last year, and they should be supported to do so. Let's just look at some figures. According to the PSNC, community pharmacists dispense 1 billion prescription items every year. They deliver healthcare advice at a rate of 48 million consultations a year. Now, just to put this in context, this saves nearly 500,000 GP appointments and 57,000 A&E visits every single week. That, by any stretch, is a service which is offering good value for money, and it does deserve better support from us. And it is part of the NHS family. We often talk about our NHS, but I often think, what do we actually mean by that? Because quite often it's conveyed, people think of our hospitals and doctors and nurses who work in them. But for me, the NHS is every single person who works in dispensing health services. And that's whether it's somebody who's a nurse or a paramedic working in a hospital trust, or somebody who's working independently, either as a GP or a pharmacist. We must make sure that whoever they and whatever the status of their employment, that if they're delivering NHS services, the NHS should make sure they're adequately recompensed for it. Now, I'm very pleased to see the Minister in her place, and I know I'm preaching to the converted, frankly, and she's a huge supporter of pharmacists, and I know that the contribution made by the sector over the last year has not gone unnoticed by her, and I would also add that the sector has felt very well supported by the recognition they've received also from the Secretary of State for Health and indeed from the Prime Minister. And it's a level of support they're not used to, frankly, and they're very grateful for that. But perhaps that is now a time where we look beyond words and beyond words of thanks and see that reflected in deeds. And I'm sad to say that whilst the sector's getting that support from ministers, it doesn't always get it from the machinery of the NHS or indeed from the Department of Health and Social Care. The truth is that there are some people in our health establishment who view pharmacists as nothing more than glorified retailers. They are not. They are medical professionals. They go through a substantial amount of training. And they don't all work for Boots and Lloyds. Most of them work very independently in small shops on our high streets in the heart of our communities. And for those, 90% of their income comes from the NHS. Now, I was sad to say that I attended a discussion where a representative from the DHSC questioned, why can't pharmacists earn money from other sources? And my answer to that is, why should they? They are providing medical services. We have a contract with the society that the NHS will meet the cost of those services. And it shouldn't be that the pharmacy sector is expected to go scrabbling around for other business to subsidise work which is done for the NHS. That is not the deal, and I think we need to properly take that on. Their fundamental business is the dispensing of prescriptions, and that is an integral part of delivering an NHS that works for all patients. So for me, the NHS has a duty to ensure that it is supporting a functional community pharmacy sector. It is not the job either of independent providers in our pharmacy sector to be subsidising their NHS work by what they can sell. That is fundamentally not the ethos of our National Health Service. So I'm very clear. We need to put our pharmacists on a more secure financial footing if we are going to maximise the use of this sector in delivering good primary care services. And we need to really look at how it is supported and how it sits with GP services in our primary care system. My challenge is for DHSC and the NHS to properly look at whether and how they can make sure that pharmacists get a fair deal. And it's fair to say that our pharmacists are held in very high esteem by the patients that use them. And that's been especially true during this pandemic, when patients often found their pharmacy was the only ready source of advice. Our 11,500 community pharmacies have been open every day for every single one of us. But as I mentioned, that has not been without real costs. And our pharmacists today are facing debts simply because they kept open. They had to supply their own PPE. They had to invest in keeping their shops COVID secure. They've had to deal with staff absence due to sickness or self-isolation. And they had to deal with increased wholesale prices of medicines. And to be fair, like most of the NHS, community pharmacies did receive funding to ensure that they could remain operational. But that was only ever advanced as a loan, and it's a loan that needs to be paid back. And that is now threatening the operation of some of our pharmacy businesses, as many as 1 in 5 estimated by Ernst & Young. It simply cannot be right that in stepping up to the challenge posed by the pandemic, some pharmacies have unwittingly crippled their businesses as the additional costs are not being properly reimbursed. So the COVID pandemic has highlighted that we are long overdue a conversation about the role of pharmacy and its place in the NHS. And this all-party group stands ready to play its part in having that debate. Central to this will be the following principles. Firstly, pharmacists can play a fuller role in primary care. GPs will face additional pressures as we come out of the pandemic. Pharmacists can give that support, but if they're going to, they should be properly supported to do so. Secondly, we will be living with COVID forever, and it looks like regular vaccination will become a bigger part of our lives as the flu vaccine. And I really want to see pharmacists fully engaged in that. There has been disappointment in the numbers of pharmacists engaged so far, which I think is due to constraints of supply of the vaccine, but I hope that going forwards that will be properly addressed. Thirdly, we do need a plan to deal with the £370 million loan to the sector. To be brutally frank, when we look at sums given to other areas of the economy, and indeed the NHS, I think our pharmacists can be forgiven for feeling a little hard done by. It will mean curtains for some businesses who act in good faith after being promised the NHS would receive all the money it needed to fight this pandemic. No pharmacist should be out of pocket for stepping up to this challenge, and we really do need to look very closely at this. Fourthly, we need to make this sector understand that it is valued, and we should encourage people to work in it. To end, I can advise the House that the all-party group held an inquiry in December where we surveyed the opinions of pharmacists. We found an overstretched workforce responding heroically to the challenge of a pandemic, with very much an attitude of doing what needed to be done, and I salute them for that. That survey also told the story of businesses being saddled with debt for doing the right thing, and it found a workforce who felt undervalued and burnt out by the professional pressure it faced. So let's have that conversation about how we secure our finances for the future. Let's properly thank them for everything they've done to support us in the last year. If we don't, we will miss them when they're gone.
The question is that this House has considered community pharmacies and the effect of the COVID-19